Explain the underlying principles of laser therapy used in animal rehabilitation. Discuss its effects on cellular processes and identify potential contraindications. Answer: laser therapy or photobiomodulation involves using light to stimulate cellular activity. It operates primarily in the red and near-infrared wavelengths 600 1000 nm, which penetrate tissue to varying depths. The light energy is absorbed by chromophores such as cytochrome C oxidase in mitochondria, leading to increased ATP production, improved cellular metabolism, and accelerated tissue repair. Effects on cellular processes. Anti-inflammatory effects. Laser therapy reduces the release of pro-inflammatory cytokines and increases the production of anti-inflammatory mediators. Analgesic effects. It enhances endorphin release and modulates nerve conduction velocity, reducing pain. Improved circulation. Laser therapy promotes vasodilation and angiogenesis. Contraindications. Over malignancies or areas with suspected cancer during pregnancy, over the uterus, directly over the eyes, without protection over areas with active hemorrhage. Describe the importance of maintaining professional boundaries when dealing with clients in a veterinary setting. Include examples of inappropriate behaviors and their consequences. Answer: professional boundaries are critical to ensure trust, respect, and a clear ethical framework between veterinary staff and clients. Violating these boundaries can compromise professional integrity and lead to legal and ethical repercussions. Examples of inappropriate behaviors: personal relationships with clients. Developing a personal or romantic relationship with a client can result in biased care and conflicts of interest. Accepting gifts or favors. This may create the perception of preferential treatment and compromise impartiality. Oversharing personal information. This detracts from professional interactions and can lead to discomfort or misunderstandings. Consequences. Legal ramifications for violating ABMA's principles of veterinary medical ethics. Loss of client trust. Disciplinary actions, including license suspension. Clear communication and adherence to ethical guidelines are paramount. Discuss the principles behind range of motion (ROM) exercises and how they benefit animals recovering from orthopedic surgery. Answer: ROM exercises are designed to maintain or restore joint flexibility and mobility. They are crucial for post-operative recovery, particularly following orthopedic surgery, to prevent stiffness and promote healing. Principles: passive ROM, performed by the technician without active muscle engagement from the animal, helping maintain joint flexibility and reducing adhesions. Active assisted ROM combines technician assistance with minimal active effort from the animal. Active ROM: the animal performs movements independently, promoting muscle strengthening and proprioception. Benefits: prevents muscle atrophy and joint contracture, stimulates synovial fluid production for joint lubrication, enhances circulation, reducing edema and promoting healing. Adherence to AVMA rehabilitation guidelines ensures a safe and effective approach. Why is accurate record keeping essential in veterinary practice? Discuss its legal implications and best practices. Answer: accurate record keeping is fundamental to veterinary practice, serving as a legal document of care and a communication tool among team members. Legal implications: compliance with regulations. Failure to maintain proper records can result in fines or penalties under FDA and USDA regulations. Malpractice defense: comprehensive records are crucial evidence in case of a legal dispute. Best practices include detailed entries of examinations, treatments, medications, and client communications. Ensure records are legible, dated, and signed. Use electronic medical record systems for accuracy and security. AVMA standards mandate that records be maintained for a minimum duration, typically 3-7 years depending on state laws. Dr. Samantha is treating a dog, Max, who has severe osteoarthritis. The client insists on administering a higher than recommended dose of pain medication at home, citing better relief. What ethical and legal steps should Dr. Samantha take in this situation? Answer: Dr. Samantha must adhere to ABMA's ethical guidelines and FDA regulations while prioritizing Max's welfare. Steps to take: educate the client. Explain the risks of overdosing, such as toxicity or organ damage, and the importance of following prescribed doses. Provide alternatives. Offer alternative therapies, such as multimodal pain management or adjunct rehabilitation techniques. Document communication. Record the discussion in Max's medical records, noting client concerns and the advice given. Report non-compliance if needed. If the client continues to administer inappropriate doses, Dr. Samantha must report the case to regulatory authorities as a potential animal welfare concern. Balancing ethical obligations with legal compliance is critical in such scenarios. Compare the effectiveness of TE NS transcutaneous electrical nerve stimulation and ultrasound therapy in managing postoperative pain in animals. Answer: TENS uses low-voltage electrical currents to block pain signals to the brain, effective for acute and chronic pain by stimulating endorphin release and interrupting nociceptive transmission. Best for superficial pain management. Ultrasound therapy uses sound waves to generate deep tissue heating, promoting increased blood flow and reducing muscle spasm, particularly effective for deeper tissues and improving soft tissue healing. Both modalities should be used in accordance with AVMA rehabilitation standards, selecting the method based on the animal's specific needs. What are the legal consequences of non-compliance with USDA regulations regarding animal medication storage and usage in a veterinary practice? Answer: non-compliance with USDA regulations regarding animal medication storage and usage can lead to serious legal consequences. These regulations are in place to ensure the proper handling, storage, and use of medications to prevent contamination, misuse, and harm to animals. Consequences of non-compliance include fines and penalties. Violations of storage regulations, such as improper handling of controlled substances or failing to secure medications, may result in substantial fines, loss of license. Repeated violations or serious infractions can lead to the suspension or revocation of a veterinary license as regulated by the USDA and local authorities. Civil and criminal liability. Non-compliance can result in civil lawsuits from clients or regulatory bodies, or even criminal charges in extreme cases, such as illegal drug distribution or misuse. To avoid these consequences, veterinary practices must adhere to strict regulations about storing medications, e.g., temperature control, secure access, and comply with reporting requirements for the use of controlled substances. Failure to do so jeopardizes animal health and legal standing. Explain how progressive resistance exercises are implemented in animal rehabilitation and their physiological effects. Answer: progressive resistance exercises are designed to gradually increase the resistance to build strength and endurance in an animal's muscles, particularly after surgery or injury. These exercises often use resistance bands, weight machines, or underwater treadmills to create progressively higher resistance as the animal's muscle strength improves. Physiological effects. Muscle hypertrophy. The animal's muscle fibers increase in size as they adapt to the increasing resistance. Joint stability. Strengthening muscles around a joint improves its stability and functionality, reducing the risk of further injury. Bone density. Resistance training places mechanical stress on bones, stimulating bone remodeling and improving bone strength. PI is highly beneficial in the rehabilitation of orthopedic injuries or surgeries, particularly for muscle rebuilding after surgery. It encourages a progressive increase in strength, enhancing the animal's functional mobility. Regular use of PI ensures better long-term mobility and reduces the likelihood of muscle atrophy or joint instability. How do stress and anxiety in animals affect their rehabilitation progress? Discuss management strategies. Answer: stress and anxiety in animals can significantly hinder rehabilitation progress. These emotional states may lead to decreased motivation, reduced compliance with therapy, and increased pain perception. Chronic stress can also result in physiological changes, such as increased cortisol levels, which can interfere with the body's healing processes. Management strategies to address stress and anxiety include calm environment. Ensure a quiet, non-threatening rehabilitation space to reduce external stressors. Positive reinforcement. Use treats and praise to encourage cooperation during therapy sessions, enhancing engagement and motivation. Desensitization. Gradual exposure to rehabilitation techniques can reduce anxiety over time. Sedation or calming aids. In some cases, the use of medications such as anxiolytics or pheromone diffusers may be necessary to manage severe anxiety. Reducing stress improves the animal's ability to focus on rehabilitation, ensuring more successful recovery and better outcomes. How does canine physical therapy help in the management of hip dysplasia, and what modalities are commonly used? Answer: canine physical therapy is a vital part of managing hip dysplasia, a common orthopedic condition that causes pain and difficulty with movement. Physical therapy aims to reduce pain, improve mobility, and increase strength in the affected hip joints. Common modalities include therapeutic exercises. Range of motion exercises help keep the hip joint flexible, and strengthening exercises improve the muscles around the joint for better support. Cold heat therapy. Cold packs reduce inflammation, while heat therapy promotes circulation and relaxes muscles. Hydrotherapy. Swimming or underwater treadmills allow for low-impact exercise, which improves muscle strength and range of motion without putting excess strain on the joints. Massage therapy helps to relieve muscle tension and reduce pain. A combination of these therapies is used to slow the progression of the disease, reduce pain, and enhance the dog's overall mobility. Physical therapy, when paired with appropriate medical treatment, greatly improves the quality of life for dogs suffering from hip dysplasia. Describe the pathway of blood through the heart in mammals, emphasizing the role of valves in preventing backflow. What might happen physiologically if one of the heart valves is dysfunctional? Answer: blood flows through the mammalian heart in a specific sequence. Deoxygenated blood enters the right atrium via the superior and inferior vena cava. It passes through the tricuspid valve into the right ventricle. From there, it is pumped through the pulmonary valve into the pulmonary arteries to the lungs. Oxygenated blood returns to the left atrium via the pulmonary veins. It flows through the mitral valve into the left ventricle. Finally, the left ventricle pumps blood through the aortic valve into the aorta and systemic circulation. Valves role: the heart valves, tricuspid, pulmonary, mitral, aortic, ensure unidirectional blood flow. They prevent backflow by closing tightly when the heart chambers contract. Dysfunction impact: a dysfunctional valve, e.g., mitral regurgitation, could allow backflow, leading to volume overload in the affected chamber. Over time, this may cause hypertrophy or dilation of the heart muscle and potentially congestive heart failure, CHF. Treatment often involves surgical repair or replacement of the defective valve. Compare the nutritional needs and feeding strategies for ruminants and monogastric animals. How does the digestive anatomy of these groups influence their dietary requirements? Answer: ruminants, e.g., cows, sheep. Digestive anatomy: a multi-compartment stomach, rumen, reticulum, omasum, abomasum enables microbial fermentation. Nutritional needs: high-fiber diets, such as grasses and hay, are essential for rumen health. Protein supplementation may be necessary during lactation or growth. Feeding strategy: provide forage ad libitum, balance with concentrates if needed, and avoid sudden dietary changes to prevent ruminal acidosis. Monogastrics, e.g., pigs, horses. Digestive anatomy: single stomach. Horses have a functional second for fermentation. Nutritional needs: require easily digestible carbohydrates, protein, and fats. Horses also need adequate fiber for gut motility. Feeding strategy: multiple small meals, balanced rations, and high-quality grains. Influence of anatomy: ruminants rely on microbial digestion, making roughage critical. Monogastrics lacking fermentation chambers need nutrient-dense diets with adequate fiber to maintain gut health. Sarah is responsible for maintaining hygiene in a large veterinary hospital that treats both companion animals and livestock. Recently, several cases of bacterial skin infections in dogs have been reported. What protocols should Sarah implement to mitigate cross-contamination, and what considerations are specific to treating both types of animals in the same facility? Answer: immediate protocols. Isolate infected animals to prevent cross-contamination. Use species-specific cleaning agents for kennels and livestock pens. Increase the frequency of disinfection, particularly in high-traffic areas. General guidelines: implement footbaths at entrances to minimize pathogen transfer. Ensure that cleaning tools are not shared between species. Train staff in species-specific hygiene protocols. Long-term strategies: conduct regular microbial testing of surfaces. Evaluate and improve ventilation systems to reduce airborne pathogens. Relevant ruler guideline: adherence to biosecurity standards, such as those outlined by the American Veterinary Medical Association (AVMA), is crucial to prevent zoonotic transmission and maintain animal welfare. Explain the role of the autonomic nervous system (ANS) in regulating cardiovascular and digestive functions. How do the sympathetic and parasympathetic divisions coordinate to maintain homeostasis? Answer: cardiovascular regulation. Sympathetic division increases heart rate and contractility via norepinephrine, preparing the body for fight or flight. Parasympathetic division decreases heart rate via the vagus nerve and acetylcholine, promoting rest and digestive regulation. Sympathetic division reduces gut motility and secretion during stress. Parasympathetic division stimulates digestive processes, including peristalsis and enzyme secretion. Coordination: these divisions work antagonistically to maintain equilibrium. For instance, after a meal, parasympathetic activity dominates to optimize digestion, while during stress, sympathetic activation diverts energy to muscles and away from the gut. Clinical relevance: ANS imbalances can manifest as tachycardia, hypertension, or gastrointestinal disorders. Why is behavioral enrichment critical in captive animal care? Provide examples of species-specific enrichment strategies for birds and primates. Answer: behavioral enrichment enhances mental and physical well-being by simulating natural behaviors. Birds Provide foraging opportunities using puzzle feeders. Include perches of varying heights and textures to mimic natural habitats, primates. Offer problem-solving toys. G. Hidden food puzzles. Implement socialization opportunities in compatible groups. Relevance. Enrichment reduces stress-related behaviors. G. Feather plucking in birds, pacing in primates, and supports overall health. Guideline. The Association of Zoos and Aquariums (OZA) recommends enrichment programs tailored to each species' ecological and behavioral needs. Explain the process of gas exchange in the alveoli of the lungs. How does the structure of the alveoli facilitate efficient gas exchange, and what factors can impair this process? Answer: gas exchange process. Oxygen from the alveolar air diffuses into the blood in the pulmonary capillaries, where it binds to hemoglobin in red blood cells. Carbon dioxide, a waste product of metabolism, diffuses from the blood into the alveoli to be exhaled. This occurs via passive diffusion across the alveolar capillary membrane, driven by concentration gradients of gases. Alveolar structure. Alveoli are thin-walled sacs with a large surface area composed of a single layer of epithelial cells, type I alveolar cells. The surface area combined with the rich capillary network maximizes the exchange of gases. Type I alveolar cells secrete surfactant, which reduces surface tension, preventing alveolar collapse. Impairment factors. Conditions like pneumonia, pulmonary edema, or chronic obstructive pulmonary disease (COPD) can thicken the alveolar membrane, reducing gas exchange efficiency. Inflammatory responses and fluid buildup hinder diffusion and oxygenation, potentially leading to hypoxia. Relevant rule of guideline. According to veterinary guidelines for managing respiratory diseases, early detection and intervention (e.g., antibiotics for bacterial pneumonia) are critical for improving gas exchange and overall lung health. How should care for livestock differ from that of companion animals, specifically regarding the management of nutrition, housing, and disease prevention? Answer: nutrition. Livestock typically require a more regimented feeding schedule with a focus on high fiber, low energy feeds (e.g., hay, silage) and specific supplementation (e.g., minerals, vitamins). Companion animals, on the other hand, generally need higher protein diets with a focus on digestibility, especially for young, pregnant, or sick animals. Housing. Livestock housing should provide adequate space for movement, proper ventilation, and easy waste management. Housing should protect against extreme weather conditions while ensuring safety and comfort, e.g., barns, pasture. Companion animals require smaller, more individualized spaces, e.g., kennels, cages with adequate bedding, comfort, and safety. Disease prevention. Livestock care focuses on herd health management, including vaccination protocols, parasite control, and biosecurity practices to prevent outbreaks of diseases like foot and mouth disease or John's disease. Companion animal care emphasizes vaccination schedules, flea and tick control, and routine health checks to prevent zoonotic diseases like Lyme disease. Guideline. According to the American Veterinary Medical Association (AVMA), proper record-keeping and individualized care plans for both livestock and companion animals are critical for disease prevention and health monitoring. Mr. Roberts owns a large farm where he raises dairy cows. He recently noticed that one of his cows, Daisy, is limping and appears to be in pain. Upon closer inspection, he finds swelling in the cow's front leg and she seems reluctant to move. Based on your knowledge of the musculoskeletal system, what should Mr. Roberts do to diagnose and treat the issue? Answer: initial assessment. Mr. Roberts should carefully examine Daisy's leg for visible injuries, heat, and tenderness. He should also check for any external signs like cuts, bruises, or swelling. A common cause for such symptoms could be a sprain, fracture, or joint inflammation. Diagnosis. Mr. Roberts should contact a veterinarian for further examination. The veterinarian will likely perform diagnostic imaging such as an X-ray or ultrasound to determine if there is a fracture, ligament injury, or joint inflammation, e.g., arthritis. A clinical examination might include checking the range of motion and palpating the joints and bones for abnormal signs. Treatment. Depending on the diagnosis, treatment could involve rest, anti-inflammatory medications, e.g., NSAIDs, or antibiotics if an infection is present. For fractures, immobilization or surgical intervention may be required. Proper nutrition and weight management will also support healing and prevent further strain on the injured limb. What role do the thyroid and adrenal glands play in regulating metabolism, and how do disorders of these glands affect animals' overall health? Answer: thyroid gland. The thyroid produces hormones that regulate the metabolic rate, protein synthesis, and growth. When functioning normally, thyroid hormones promote energy production and heat regulation by stimulating the mitochondria in cells. Disorders like hypothyroidism, low thyroid hormone levels, can lead to lethargy, weight gain, and poor coat condition, while hypothyroidism, excess thyroid hormone, can cause weight loss, increased appetite, and hyperactivity. Adrenal glands. The adrenal glands produce cortisol, which helps regulate metabolism, immune response, and stress adaptation. Disorders such as Cushing's disease, excess cortisol, can cause symptoms like increased thirst, frequent urination, and muscle weakness. And Addison's disease, insufficient cortisol, can lead to weakness, vomiting, and hypovolemic shock due to electrolyte imbalances. Describe the process of urine formation in the kidneys, including the role of filtration, reabsorption, and secretion. What happens when there is a dysfunction in any of these processes? Answer: filtration. Blood enters the kidneys through the renal arteries and is filtered in the glomeruli, where water ions, glucose, and waste products like urea are separated from the blood. This forms the filtrate. Reabsorption. As the filtrate moves through the proximal convoluted tubule loop of Henle and distal convoluted tubule, essential substances like glucose, water, and sodium are reabsorbed back into the bloodstream. This process helps maintain fluid and electrolyte balance. Secretion. Waste products that were not initially filtered out, e.g., certain drugs, hydrogen ions, are actively secreted into the urine through the renal tubules. Dysfunction in back. If filtration is impaired, e.g., glomerulonephritis, waste products accumulate in the bloodstream, leading to uremia. Problems with reabsorption, e.g., diabetes mellitus, can cause excessive urination and dehydration as glucose or other substances are lost in the urine. Dysfunction in secretion, e.g., renal tubular acidosis, can disrupt acid-base balance, leading to metabolic acidosis. Explain the process of drug metabolism in animals and its significance in veterinary practice. Include the role of the liver and the concept of first-pass effect. Answer: drug metabolism, or biotransformation, is the body's process of chemically altering drugs to facilitate their elimination. It typically occurs in the liver, where enzymes such as cytochrome P catalyze reactions to convert lipophilic drugs into hydrophilic metabolites. These metabolites are more easily excreted via the kidneys or bile. The first pass effect occurs when orally administered drugs are absorbed through the gastrointestinal tract and transported to the liver via the portal vein before reaching systemic circulation. The liver may metabolize a significant portion of the drug, reducing its bioavailability. Understanding this is critical in veterinary practice for determining appropriate dosages and administration routes, e.g., choosing intravenous over oral administration for drugs with extensive first-pass metabolism. Laws governing drug usage, such as the Animal Medicinal Drug Use Clarification Act (AMJUCA), emphasize understanding pharmacokinetics for safe and effective treatment. When performing a complete blood count, CBC, what are the critical parameters to evaluate, and how can abnormalities indicate underlying disease conditions? Answer: a CBC includes the evaluation of red blood cell (RBCS), assesses anemia or polycythemia. White blood cell (BCS) evaluates immune response such as neutrophilia, infection, inflammation, or eosinophilia, allergic or parasitic conditions. Hemoglobin (HB) and hematocrit (HET) measures oxygen carrying capacity and hydration status. Platelets indicates clotting ability, with thrombocytopenia suggesting bleeding disorders or bone marrow suppression. Normalities must be interpreted alongside clinical signs. For instance, leukopenia may indicate a viral infection, e.g., feline leukemia virus, requiring confirmation through additional diagnostics like serology. Veterinary practices must adhere to standards such as those outlined by the American Society for Veterinary Clinical Pathology as for accurate and ethical sample analysis. Dr. Patel notices that a controlled substance log shows a discrepancy in the quantity of morphine vials. The log indicates 10 vials, but only 7 are in stock. What steps should Dr. Patel and the animal health technician take to address this situation in compliance with legal regulations? Answer: in this scenario, immediately report the discrepancy to the supervising veterinarian and document the incident in the controlled substances log. Conduct a thorough investigation to confirm whether the discrepancy was due to clerical error, theft, or improper disposal. Notify the Drug Enforcement Administration. D. If the issue involves a theft or significant loss, as required under the Controlled Substances Act (CSA). D. A Form 106 should be completed for such reports. Implement corrective measures such as improved storage security and training for proper documentation. Failure to comply with these steps can result in severe penalties, including fines or suspension of licenses. Describe the flotation method for detecting gastrointestinal parasites in animals. What principles underlie this diagnostic technique? Answer: the flotation method detects parasitic eggs in fecal samples using solutions with high specific gravity, such as sodium nitrate or zinc sulfate. Parasitic eggs, being less dense than the solution, float to the surface and can be collected on a cover slip for microscopic examination. Key steps include mixing a fecal sample with the flotation solution, centrifuging or allowing the mixture to sit undisturbed to enable the eggs to rise, placing a cover slip over the surface to collect eggs. This method is effective for detecting common parasites like Toxocara canis or Ancylostoma. Proper sample handling and adherence to guidelines, such as those from the Companion Animal Parasite Council (CAC), are crucial for reliable results. Why is proper labeling of diagnostic samples critical, and what guidelines ensure their integrity during transport? Answer: proper labeling of diagnostic samples is essential to ensure accurate identification and prevent errors in analysis. Each sample must include key information such as the patient's name, species, type of sample, collection date, and the clinician's details. Mislabeling or incorrect sample information can lead to incorrect diagnosis and delayed treatment, which can be detrimental to the patient's health. Furthermore, labeling ensures traceability and accountability, important in case of legal concerns or audits. To maintain sample integrity, guidelines from organizations like the International Air Transport Association (IATA) must be followed. These include using leak-proof, appropriate containers for transportation, particularly for hazardous or biologically sensitive samples. Temperature-sensitive samples, such as blood or serum, must be stored and transported in refrigerated conditions to prevent degradation. Adherence to specific transport guidelines ensures that samples reach diagnostic laboratories in optimal condition for accurate testing. Following good laboratory practice (GLP) and good clinical practice (GCP) further ensures the accuracy and integrity of samples, promoting reliability and results. Discuss the consequences of improper storage of vaccines and how to mitigate risks in veterinary practice. Answer: improper storage of vaccines can lead to their degradation, reducing their efficacy and potentially leading to ineffective immunization in animals. Vaccines are sensitive to temperature fluctuations and most require storage between 2 and 8 Exposure to higher temperatures, freezing, or light can alter their chemical structure and diminish their ability to provoke a proper immune response. This increases the risk of animals contracting preventable diseases, undermining both veterinary treatment and public trust. To mitigate these risks, veterinary practices should ensure proper storage conditions by using temperature-monitored refrigerators, ideally with continuous logging systems to track temperature fluctuations. Vaccines should be stored in their original packaging to protect them from light and avoid unnecessary exposure to air. Regular checks should be conducted to ensure that refrigerators are functioning properly and that backup power systems are available to prevent temperature losses during power outages. Additionally, veterinary staff should be trained in proper vaccine handling and storage protocols in line with guidelines provided by the World Health Organization (WHO) and the American Veterinary Medical Association (AVMA). By adhering to these practices, the risk of vaccine inactivation can be significantly minimized, ensuring safe and effective vaccination programs. How does the ELISA test detect antibodies, and why is it crucial for diagnosing infectious diseases in animals? Answer: ELISA, enzyme-linked immunosorbent assay, is a widely used technique for detecting specific antibodies or antigens in a sample. The test involves immobilizing an antigen on a solid surface like a microplate. If the sample contains the specific antibody, it will bind to the antigen. A secondary antibody, conjugated with an enzyme, binds to the antibody-antigen complex. Upon adding a substrate, the enzyme catalyzes a reaction that produces a detectable color change indicating the presence of antibodies. The ELISA test is crucial in diagnosing infectious diseases in animals because it can detect antibodies specific to pathogens even before clinical symptoms appear. For example, in diseases like feline immunodeficiency virus, FIV, or canine parvovirus, an ELISA test helps to identify exposure to the virus by detecting antibodies produced by the animal's immune system in response to infection. This early detection can guide the treatment process, quarantine decisions, and help in preventing the spread of contagious diseases. Moreover, ELISA tests are relatively simple to perform, cost-effective, and provide results quickly, making them an invaluable tool in veterinary diagnostics. Compare the mechanisms of action of bacteriostatic and bactericidal antibiotics, providing examples of each. Answer: bacteriostatic and bactericidal antibiotics work differently to combat bacterial infections. Bacteriostatic antibiotics inhibit bacterial growth and reproduction, essentially limiting the ability of bacteria to multiply but not directly killing them. These antibiotics depend on the host's immune system to eliminate the bacteria over time. An example of a bacteriostatic antibiotic is tetracycline, which interferes with protein synthesis by binding to the bacterial ribosome. In contrast, bactericidal antibiotics directly kill bacteria by disrupting essential cellular functions such as cell wall synthesis or DNA replication. This action typically results in bacterial cell death, making bactericidal antibiotics particularly effective in treating severe infections in immunocompromised animals. An example is penicillin, which targets bacterial cell wall synthesis, leading to cell lysis and death. The choice between bacteriostatic and bactericidal antibiotics depends on the nature of the infection and the animal's immune status. In cases of severe infections, a bactericidal antibiotic may be preferred to ensure faster and more complete eradication of the pathogen. What are the critical steps in preparing a blood smear, and how does poor technique affect diagnostic accuracy? Answer: a blood smear is a crucial diagnostic tool used to examine blood cell morphology and detect abnormalities. The preparation involves several critical steps to ensure accuracy. Drop of blood. A small drop of blood is placed at one end of a microscope slide. Spreading. A second slide is used to spread the blood sample evenly, with the edge of the slide placed at a 3045 angle to the first slide. The blood should be spread quickly to avoid clotting. Air drying. The smear must be allowed to air dry completely to prevent distortion of the cells. Poor technique can severely impact the diagnostic accuracy of the smear. If the blood is spread unevenly, it may result in an inaccurate distribution of cells, making it difficult to identify abnormalities such as anemia, leukocytosis, or parasitic infections. An improperly prepared smear may also distort cell shape, making it difficult to interpret the results. Furthermore, if the smear is not dried properly, its staining can be inconsistent, leading to artifacts that may mimic disease processes. Therefore, proper technique and attention to detail are essential to obtain reliable, accurate results that can guide effective treatment. Explain how the absorption rate of drugs is influenced by the route of administration and the role of the gastrointestinal tract in drug absorption. Answer: the absorption rate of drugs is significantly influenced by the route of administration. When drugs are administered orally, they must pass through the gastrointestinal GI tract before entering the bloodstream. The GI tract plays a critical role in drug absorption by breaking down the drug into smaller molecules, allowing it to be absorbed into the bloodstream through the lining of the stomach or intestines. Oral administration often results in slower absorption due to the need for the drug to undergo digestion and first-pass metabolism in the liver. First-pass metabolism can reduce the bioavailability of certain drugs, meaning the amount of the drug that reaches systemic circulation is lower. Drugs administered intravenously, Roman on the other hand, bypass the GI tract and liver, entering directly into the bloodstream, resulting in immediate and complete absorption. The rate of absorption also depends on factors such as the drug's solubility, the pH of the stomach, and the presence of food. For instance, some drugs, such as aspirin, are absorbed more effectively when the stomach is empty, as food can delay gastric emptying and change the pH of the stomach, reducing drug solubility.